Evening. As experts continue to analyze the data surrounding COVID cases in Toronto, public health is diving deeper into the virus and identifying other trends in the pandemic that could have been spotted earlier. While the discussion surrounding how race and economic status has been brought up elsewhere in the world, including the U.S., only now is Toronto saying these are factors in determining who is contracting COVID-19. Toronto's medical officer of health, Dr. Eileen de Villa, says the virus is affecting people in lower income areas and there are higher case numbers and hospitalizations among immigrants.
Recall that we introduced a new information system to help us better manage cases. We are updating that system as we speak, and we should soon be introducing this method of collecting socio-demographic information on our cases.
Meanwhile, ahead of this Mother's Day weekend, Mayor John Tory says he's had conversations with the Mount Pleasant Cemeteries group to determine if they would consider opening locations. The private properties were shut down last month due to concerns about proper social distancing, but indications are there could be some allowances for family visits.
Their reopening plans, soon to be confirmed, are not likely to include opening hours on Mother's Day itself, but will likely include opening hours on days either side of Mother's Day. I hope this will allow relatives to visit the resting place of loved ones and do so very near to Mother's Day in this very unusual year.
Some troubling news from inside the city's healthcare system tonight. 2 patients are dead as one Toronto hospital struggles to contain a COVID-19 outbreak. 4 units of Toronto Western Hospital have become infected. In addition to the 2 dead, 19 patients and 46 staff members have tested positive for the virus. The affected parts of the hospital have been closed to new admissions and are undergoing repeated deep cleanings. Let's take a look at the impact of the virus across Ontario, where experts say we're still waiting to see the numbers that will help determine when life can start getting back to normal across this province. Health officials are confirming 387 new coronavirus cases today. That's up slightly from the 370 reported on Monday. 61 more people have died, pushing the total to close to 1,400. Ontario has now seen more than 18,000 cases, but nearly 70% of those are considered resolved. This is the graph that provincial officials are keeping a close eye on in the ongoing battle to flatten the curve. You can see a steady drop in cases over the past few days, followed by a slight uptick today. Ontario's Chief Medical Officer of Health notes that this is the 4th day in a row that numbers have stayed low, and he's hoping that trend will continue even as testing in the province ramps up. Now, City News did notice a steep drop in the number of tests completed yesterday, down 7,000 since Sunday. Artina Yazdani asked the Premier about that decline today.
Isn't the province using its full testing capacity, and how can we even think about reopening when we don't have a clear picture of how this virus is spreading in our communities?
I'll tell you right now, I'm disappointed on the chief medical officers in certain regions. I'm not going to name them. They know who they are. Start picking up your socks and start doing testing. I don't know what the big problem is with them testing. It's frustrating as anything.
Now, Ontario's Chief Medical Officer of Health was asked about that fiery response from the Premier. He says there's a number of issues at play: supply shortages, coordination, data entry, and weekend sample delivery, just to name a few. But he did note we don't need any more excuses. We need solutions to ensure we speed up the process and have data accurately recorded and analyzed. Meantime, the Premier says the prior we can begin random community testing just yet, especially after Health Canada recalled a promising rapid test for COVID-19, which was supposed to offer results in just 45 minutes. They are the frontline heroes during one of the worst public health pandemics our country has seen, caring for those most impacted by COVID-19. Today, public support workers came together to mourn the loss of their own. 3 minutes of silence this afternoon for 3 long-term care employees who lost their lives. Christine Magdaguer.
We have issued a number of directives for many weeks, including most recently that there are no people allowed to visit long-term care homes except for if a death of their loved one is imminent. We have employed the use of...
Today, the Premier pledged $12 million for virtual and online mental health supports to help those struggling during the pandemic. He says it can be accessed safely from home, where you can take an assessment and speak with a therapist. A mariachi band performing for the residents at Del Manor Winford Retirement Home in the East End today for Cinco de Mayo. Management at the facility say the performance is their way of bringing residents together while staying physically apart. And that is our show for tonight. Toronto's news is always available on the City News Facebook page and citynews.ca. You can hear breaking news overnight on 680 News on your AM dial. And your next City News comes tomorrow morning on Breakfast Television. Thanks so much for watching. Have a good night.